I was drawn to medicine. I think I realized I liked kind of problem solving a little bit and, trying to figure out solutions to problems, and then pediatrics, because I feel like that's really a time where I can help parents navigate from everything from the early days when you have your newborn at home and up through the different phases. I am a general pediatrician. I see kids from newborns up until they're about 18 years old in the clinic for everything from their scheduled checkups and well-visit exams to sick visits if they're sick or parents are concerned about something and need to bring them in for some extra visits. So we really see huge transitions, even from when they're born to when they're a toddler, seeing all those transitions. They've come in and have started talking, running, being more interactive with me. Pediatrics, I think, is unique because you build a relationship with the child, but then also with the family. When you're starting with a baby, you're mostly talking to the parents, but I enjoy them as the kids get a little bit older. That's one of my favorite parts of the job, the questions I get from the kids, because sometimes it's totally out of nowhere, nothing related to why they're here for their checkup or for their visit. I always try to start the visit talking with them first. And then kind of switch gears and talk with the parents and make sure all their concerns are getting addressed as well. And also just talking the kid through what's happening at the visit, because they often are kind of nervous or unsure of what's going to happen, especially when it comes time for me to do my physical exam. So telling them everything I'm going to do so that hopefully they're comfortable, and also trying to be a little fun and silly too, so it's hopefully a enjoyable experience. I, strongly believe in evidence-based medicine, so, I follow what the American Academy of Pediatrics recommends doing in terms of care plans and treatment plans and vaccination schedules. I often ask for parents' input. I tell them what I think or what I think, we should do for their child. What do you think about that? Do you have any questions? The kids, they're funny and silly, and sometimes the lack of a filter of things that comes out of their mouth can be really rewarding. And then also just that kids are very resilient. So I am a mom. I have two young kids at home. So that honestly takes up most of my time. And I do think that helps me be a better pediatrician. I know what it's like to be on the other side of that relationship.